The heartburn drug Zantac was pulled off of store shelves due to potentially cancer-causing ingredients. But should you be concerned if you've taken the medication recently? Our own Melissa Eichmann sat down with Dr. Scott Powell to get those answers in today's In Depth.
Dr. Scott Powell from Florida E.N.T. and Allergy joins us to talk about Zantac being pulled from drugstore shelves. First of all, there was a recall. Tell us what prompted that recall, doctor.
Well, the drug companies themselves did some studies and found that this NDMA was in higher levels than they were comfortable with in their drugs. And they started off with the Zantac, and they proceeded to the generic of Zantac, which is called ranitidine. And so based off of that, they sent a red flag to the FDA, and that started the ball moving.
Okay, and describe what is the major concern here with this chemical? This is something we've heard about in the blood pressure meds, and you mentioned some food and drinking water. What's the major concern with this chemical?
Well, in animal studies only, they found that it can cause in high quantities cancer. And so they do not have human studies of this, so they don't know for sure, but they're assuming there's a connection there. And so based off of this, and it was higher levels than they were comfortable with, everyone started pulling things off the shelf as a precaution.
Okay.
Now, of note, what they found on the FDA side was the testing they were due at the pharmacy level, the heat and temperature of the study was way higher than what they normally would test for, higher than the human body.
Okay.
Therefore, the levels that were released were much higher. So it's kind of a little bit of a conflict.
So what do people who've been taking Zantac or these medications, what do they need to do?
Well, the first thing they can do is call their physician. And there's a lot of alternatives to the medication, even in the same exact family. So what they can do is they can stop the medication if they're worried, it's not overly urgent, call their primary care, their physician who prescribed that, and they can change them to something else and have an honest conversation.
Okay. And what kind of tips do you have for your patients? I mean, as far as even changing the medication, are there things that your patients can do to help with that acid reflux and to help with that heartburn, which is what this medication is supposed to be helping?
Sure. The whole reflux issue, I always tell my patients, it's kind of the American diet. It's how we eat, it's when we eat, and what we eat. We tend to overeat, eat and rush, and do all the things that make the acid have a chance to come up. So if we were to slow down and actually eat smaller meals, be conscious of what we're eating, less greasy, fatty, spicy foods, acidic foods. The American diet is very, very acidic, which is very tough. These medications help mask that problem. They don't stop it from happening. And so there are alternative medications, and just really dietary awareness is the key.
Okay. And more, what kind of questions are your patients asking when this medication was recalled? What kind of concerns are they coming to you with, and what are you telling them?
Well, the big thing is whenever you hear about cancer causing, there's a lot of paranoia that comes on, and rightfully so. But as I mentioned, this is found in a lot of foods. It's a chemical that's released as a byproduct. Smoked meats, beer, wine, these are found in these fermenting processes that we can't hide from completely, but we do know that at high quantities are dangerous. The other one that's more dangerous is in water treatment plants. It can get into the water cycle. So that's a concern. So most of the time it's just being aware this is a possibility. It's an event that happens. Okay. Just be conscious of those medications.
Okay. And what are some other tips that you give your patients to kind of help with some of these conditions?
Well, the biggest thing of all is the diet is huge, but from medication side of things, there are medications that are much more severe or strongly against the reflux, and those are the proton pump inhibitors, or the PPIs we call them, the Nexiums of the world, and they have their own worries and risks.
Sure.
So a lot of people take these medications around the clock and just take it like a vitamin. The concern there is, do they still need it?
Okay.
They take it so often, they don't even know. So the best thing to do is talk to their physician and say, can this come down? Do I take it on occasion, on an as-needed basis, if they have a cheat day, if you will, right, and then come back off of that and see if they can do without.
What else, doctor, do we need to know about these recalls, these red flags when we hear about them in our medications?
Well, the big thing is just take a deep breath, because it's not something that's really moving the needle all that much just yet. We don't even know. Now, across the world, where all these companies and all these countries are pulling them off the shelf, whether they've been proven or not yet, which is safe. I get that. But the concern now is, okay, everything needs to be pulled off the shelf. If one medication is bad, they're all bad, and that's not the case. And so, unfortunately, there's a lot of innuendo that, okay, it's not safe. Do I need to, take legal action? Do I need to do something about this? And I just caution people just to take a deep breath, talk to their physician. That's what we're there for. Walk through a path and come up to a common theme.
Okay, and for now, you're suggesting to stop that medication, consult your doctor, and try something else, right?
Try something else. There's plenty of options.
Okay. We're just about out of time. Any final thoughts on this topic?
No, I think the main thing is just to take a deep breath and
Yeah.
talk to your physician.
All right, doctor, thank you.
Thank you.